Hello, my name is Jamie Babb, and my systematic review was about the effectiveness of community health worker interventions in adult Hispanic Latino diabetic populations in the U.S. During this presentation, we will cover a background of the issue, included studies in the systematic review, the results, limitations, and finally recommendations. Diabetes mellitus, or DM, is an epidemic in the United States, with over 30 million Americans having diabetes. The high incidence of diabetes is concerning due to the mortality, morbidity, and cost increases associated with this disease. Even though a Healthy People 2020 goal is to eliminate health disparities and attain health equity, ethnic and racial minorities still experience greater disease burden and complications from DM. The Hispanic Latino population is the fastest growing minority population in the United States. Additionally, the incidence and prevalence of DM in Hispanics is twice as high than non-Hispanic whites. Barriers to diabetes management involve factors of all levels, from individual to environmental and systemic. Therefore, effective approaches to managing DM must be culturally competent as well as multifaceted. Unless public health interventions are implemented with these requirements in mind, DM-related health disparities will not reduce. The last systematic review of DM-CHW interventions was over 10 years ago. This review was not specific to Hispanic Latino populations, and special attention needs to be given to this group due to their disproportionate burden of the disease that they suffer. Community health workers, or CHWs, are typically representative of the clients they are serving and link communities and clients with healthcare resources to improve health outcomes. CHWs address individual and systemic barriers and have shown positive DM management in the target population. Therefore, the aim of this systematic review is to determine if CHW interventions improve DM health outcomes in adult Hispanic Latino patients in the U.S. Systematic reviews are a type of research study that identifies, evaluates, and synthesizes evidence about a specific research question in order to provide evidence-based testing of a hypothesis. Without systematic reviews, the vast amount of research would prove to be too difficult to determine the best practice standards. However, a systematic review can provide an objective assessment of the research, consolidating it in a way that enables the direction of practices, policies, and funding. This is especially valuable to decision makers and professionals who have limited time. These criteria hold true when researching the effect that CHW interventions have on DM health outcomes in Hispanic Latino patients. To further advance public health and healthcare policy, decision makers as well as health professionals must have current, consensus-based best practices available. Conducting this systematic review will enable individual healthcare providers and policymakers to ascertain the usefulness of CHW interventions within Hispanic Latino populations based on a synthesis of the most current evidence. A systematic search of 4 databases using the inclusion criteria, community health worker, diabetes, randomized controlled trials, and minorities or minority or ethnic group led to a total result of 62 articles. These were screened for inclusion into the systematic review, which ultimately resulted in 8 pertinent articles. 5 articles were excluded due to duplication. Next, non-scholarly articles and articles older than 10 years were eliminated to maintain the inclusion of current, valid studies that resulted in the exclusion of 4 studies. Foreign country studies eliminated 2 studies. Next, full text studies were assessed. Studies where the outcome measured was not a diabetic health outcome based on a CHW intervention in DM minority patients, or the intervention had not been evaluated, were eliminated so that the selected studies could be used to test the hypothesis. Lastly, studies that had been initiated but not carried to completion or evaluated resulted in 14 studies being excluded. While there were no articles in a foreign language or where a text was not attainable, These are exclusion criteria that would have been used if necessary due to limited resources. This resulted in 8 studies, all of which took place in the Hispanic Latino populations. All of these studies were randomized controlled trials. Here's a summary of the results of the systematic analysis. In the ineffective intervention box, studies are highlighted where the intervention was not effective, there was a lack of association between CHW intervention and hemoglobin A1C levels, and the outcome of the study conflicted with expected results. The effective intervention highlighted studies with the opposite of these 3 points. For your information, hemoglobin A1C levels are the measure that's used to determine if a patient has diabetes. The higher the hemoglobin A1C level, the more at risk a patient is for diabetes. Ultimately, 6 of these studies found a significant difference between CHW intervention group and the control group, with the CHW intervention group having lower hemoglobin A1C levels than the control group. It is important to note that the 2 studies that did not find the intervention to be effective had control groups with supplemented care, meaning that the control group received the standard of care plus a physician intervention or perhaps a social worker intervention, where the 6 effective intervention studies only used a standard practice control group as compared to a community health worker intervention. There are several limitations and delimitations in this study. Limitations are something that is out of the control of the researcher, while delimitations are within the researcher's control. The first limitation is publication bias. Publication bias is when studies are not published that have undesired results. This can be a large problem in systematic reviews because they are based off of only published results. Second, this study only had 1 researcher. Therefore, this could have affected the systematic search and the quality assessment process. Researchers recommend having at least 2 assessors for best results. However, due to restricted resources, this was not possible. Having 2 assessors would have also decreased the chance of personal bias. I tried to limit personal bias by having the methods approved by my advisor and by abiding by those methods throughout the study. Additionally, the research was done over a relatively short time, about 3 months. However, I made every effort to be thorough and conduct extensive searches. In the future, the review should be completed with at least 2 independent researchers. This will ensure reliability as well as validity. The studies also used varying intervention design, making direct comparisons difficult. On the other hand, all the studies were randomized controlled trials and used a medically measured indicator, hemoglobin A1C, which strengthens the validity and reliability of the systematic review. Additionally, all of these studies used similar populations, making it generalizable to this population, but not beyond. However, generalizability in adult Hispanic Latino diabetic populations in the U.S. should also be used with caution due to the presented biases and varying study methods. Lastly, moderate sample size in the reviewed studies should also be considered and may decrease the validity and generalizability of the results. This shows that there were several limitations or otherwise outcomes that the researcher could not control. As previously mentioned, health disparity reduction is a national priority and is vital to upholding the ethics of public health. This study supports that CHW interventions effectively improve DM health outcomes in Hispanic Latino populations in the United States. However, additional research should be done to strengthen the argument for CHW intervention use. Studies should focus on larger populations of differing demographics and intervention types to make the results more generalizable. Complicating this matter is the fact that there are many different CHW interventions in use. Future research should focus on comparing these intervention types and formulating best practice guidelines. Similarly, researchers should establish evidence-based interventions in order to have the most positive impact on public health. Advocacy for policy change should also take place. Policymakers should increase funding to local health departments for the implementation of CHWs for this patient population. Additionally, health systems should investigate employing CHWs for this patient population in order to improve health outcomes. In summary, this review shows that CHW interventions effectively reduce DM rates and adverse outcomes, particularly within desperate groups and especially among Hispanic Latino. Therefore, it warrants further study on a larger scale to see if CHW interventions reduce health disparities across multiple groups. This systematic review has not only shown the effectiveness of CHW DM interventions, but can also serve to shape future research and policy development in healthcare towards a high-quality, holistic approach for diabetic patients. Health departments, hospitals, and insurers should consider implementing CHWs as a way to improve DM health outcomes in Hispanic Latino populations. Thank you very much for watching my presentation, and thank you to my professors who have helped me throughout this process, as well as Concordia University and the classmates from my MPH 530 and 598 class.